So when we go to design the interventions for learning kind of what this behavior is communicating, we have to take the time to understand their skills. So how do they communicate? And if there is no communication system, we're probably going to need to start working on one, but it might be very simple. It is not true that every person can learn, one set of kinds of communications, right? I know many families have tried all sorts of communication strategies with not a lot of success. And so we really have to look at that individual, their strengths, what's been tried. And then sometimes we go back and try again because your brain continues to develop. And while you may not have been ready at the age of 6 and 7, 14 or 15, you may actually be ready to try that again because you've learned some prerequisite skills. So again, we never stop trying, but we really have to think about communication is key. I don't just teach communication and behavior replacement, but it is key because even if I do some other replacements, if you're sensory seeking, and I'm going to replace your sensory need with an appropriate way to get it. So I may not want you to suck your fingers, but we're going to give you, if that's an oral stimulation, want other ways to get oral stimulation so that you don't get the skin breakdown. Or if you like wetness on your hands, we're going to give you other ways to get that feel that won't, again, cause the cellulitis and the skin breakdown. But over time, I'd really love it if you can communicate for those things when you want versus the adults around you having to anticipate those for you, because that is just going to continue to build that good quality of self-advocacy that we want to see develop. And we have all sorts of outcomes with that, but my goal is always to get anyone there. But we also want to think about their current behavior regulation and coping. We might have to work on some of those, how they learn best. And again, it's not every child with autism or autistic person has a visual strength. Sometimes it's auditory. Sometimes we need to go different routes. And that's a huge myth in the field with learning styles, where everybody wants to, teach everybody the same way, and it just doesn't work. Again, your baseline sleep and how you feel, your activity level. Do we have mismatches that we need to address in part of that treatment, et cetera? And then what do you like? Because I'm going to build on that and see if we can build on those current strengths and your likes and build towards the quality. And then we want to teach skills that are foundational and have a direct impact on that behavior, especially if it's a problematic behavior. But sometimes we have to take steps, small steps to build. So it takes a little bit to get to something that's going to impact the behavior pretty robustly. And that can take some significant time and work.